Welcome to the next edition of Dr. Twyman's Ask Me Anything. So for those that are new, I'm Dr. Twyman, board certified cardiologist, and I focus on heart attack and stroke prevention in my practice of Apollo Cardiology in St. Louis, Missouri. For the past couple of years, every Monday night, 6 p.m. Central Time, I've been doing these Ask Me Anythings. Often it's focused on vascular health, but do talk about circadian biology, mitochondria, quantum health topics as well. So there's a lot of great questions that were asked ahead of time tonight. If you fill them in before I see them. I usually will answer them as we go. And if we have time, we'll answer some more of the questions in the comments. Yes, this is always being recorded. The replays are always going to be in my feed. And then often a lot of these are getting repurposed up on YouTube and using AI to be able to transcribe them. And so you can kind of search by the question asked if you want. So we'll give a few people a couple more minutes to log on here, and then we'll fire up some of the questions. But in my story, you probably saw that I was in Savannah and Beaufort this weekend. I'm back today. The Low Country is where I was stationed when I was in the military many years ago, and just wanted to go back to see some of our favorite haunts and go to some of our favorite restaurants. And there's just some amazing walkable, old kind of neighborhoods in both Beaufort and Savannah. So enjoyed that. Got back last night and back at Apollo Cardiology today, helping people not have heart attacks. So here we go. We'll answer some questions for here tonight. Question about a Sol-Basin Bright, which is a photobiomodulation panel. Can I detail times and where to aim the light to best help mitochondria? So I can't give you exact times because I don't know exactly what you're trying to treat. And, it is basically like a medical prescription. So you need to know that person's context before you can give them exact, regimen and dosage. But the mitochondria are, mostly dense in your heart, brain, and musculoskeletal system. So that's where most benefits come from using photobiomodulation. So if something is injured, that's where you want the light to be directed. And it depends on what you're treating is going to be what dose you're looking for. So you need to talk to the person who recommended that you get that panel and walk through helping devise a protocol for it. Can red light help just aiming at face and neck help your mitochondrial health? Possible. It's going to help, stimulate the microcirculation. So off-target effects, can be helped with red light therapy. There was a trial that was done in Israel looking at patients who are having heart attacks, and they were using the light therapy on their tibia to activate stem cells. They never actually treated their heart, and those patients had decreased elevations of their CK and B and troponin levels, which are markers of myocardial damage or heart attack size. So yes, you can get some benefits off target. Somebody's asking me, do I recommend a gut microbiome test for helping cardiac health? If so, which one? That's outside my area of expertise, so I don't particularly do that myself. I have lots of capable colleagues in St. Louis and around the country that do that for me if needed. But Vibrant America, or I believe it's now known as Vibrant Wellness, they have some of those panels as well. Can resting heart rate indicate anything about the endothelium? Probably indirectly. A normal resting heart rate probably should be in the 60s, 70s, but if you have a higher resting heart rate in the 100, 110 range, do you also have other issues that would cause hypertension, that would decrease vascular health and cause glycocalyx destruction? So not directly. I guess also indirectly, if you have a higher resting heart rate, maybe you have higher cortisol levels, higher adrenaline, those can damage the glycocalyx. So indirectly, possibly. How many servings of leafy greens per day is needed to raise NO levels? It's going to depend on where you are in the world and where that food was grown, and if that food is organic or conventionally grown. Conventionally grown foods have approximately 10 times more nitrates than organically grown, and this was done by some of the research by Nathan Bryan, where he looked at different vegetables from five different cities, and it has a varying concentration of nitrates. in the foods, depending on where it was grown. So unknown how many servings, because it depends on what the soil conditions were. So that's why if you have low nitric oxide levels and you've gotten rid of the things that could damage it, like mouthwash and proton pump inhibitors, and if you've done blood testing, you've optimized your homocysteine and uric acid levels, then often a nitric oxide promoting lozenge or capsule may be useful, because you may not be getting enough in your dietary regimen. Why is CIMT, which stands for carotid intimal medial thickness testing, not offered by healthcare facilities? Even a well-known university doesn't offer that test. I don't have a ready explanation for it. In St. Louis, when I was still in my prior practices, there was only one place in St. Louis I was still offering it. And then once I was able to launch Apollo Cardiology, almost 5 years ago now, we've had it from day one. Initially, we had some outside consultants that would come in and do the scans for us, once or so a month. Now we have all the gear, and our medical assistants in our office are trained on how to do the scans, so we can do them at any point in our office. Don't know why they wouldn't offer it. I mean, it's similar technology to a carotid artery duplex scan, but you need a piece of software that can actually measure the intimal thickness. So it's one of the tests where it's also a good test that's used in research studies to look at the effects of certain lipid-lowering therapies, or if you're looking for a plaque stabilizing supplement, does it actually work? CMT is often used as a surrogate for that. So it's often used in research studies, but it's one of those tests where it's not covered by medical insurance. So often, healthcare facilities make decisions based on if it's covered by insurance or not. Question about, can Repatha cause weight gain in folks with no blood sugar or glucose issues? I've not seen that, and I don't think that's a well-known side effect of it. If somebody could not tolerate Repatha itself, potentially another PCSK inhibitor like Praluent or the small interfering RNA, the Elasclerin, may be able to do it. Or if you can't tolerate those for any reason, then potentially Nexletol or ezetimibe, or the combination of them, Nexlizet, if you're already been on statins and not tolerating them. Otherwise, statins would still potentially be preferred in those situations. Question about many human beetroot products recommend to choose is powder, same as the capsules. So for the company Human, the only two products I ever recommend that people consider with them are their original Neo 40 lozenges. Usually it's 1 tablet twice a day for a month, and then you cut down to 1 tablet a day, depending on if you're getting a response with 1 a day. Otherwise, you just stay at the twice a day dosing. Or their Super Beats powder. Those are only two things that I know actually can promote nitric oxide. Everything else is somewhat debatable. So this is a trick question because I won't have one for you. So what are the 3 top supplements to combine with sun exposure and or red light therapy? Everybody's individual, so it's going to depend on what they need. But often it may be a nitric oxide promoter, either a lozenge or capsule. Some patients need a glycocalyx promoter. And then there are various things that may help with the lipoproteins or lower oxidative stress or inflammation. So it's going to depend on what you're deficient in. So Atherosclerosis, which is a proprietary product from Calroy. In full disclosure, I speak for them on occasion for different webinars and presentations. So Atherosclerosis, or beetroot powder, for prevention of soft plaque and decreasing LDL. So they're not really going to directly lower the lipoproteins. They're going to support nitric oxide, and Atherosclerosis particularly is going to help regenerate the glycocalyx, so that the lipoproteins don't stick to the arteries in the first place, and you develop the soft plaque and potentially later the hard plaque. So between them, they're not necessarily mutually exclusive. You may use them in combination. So that just piggybacks onto it. The supplement for healthy glycocalyx arteries in patients that I see, if they have evidence of endothelial dysfunction or they have more advanced markers of vascular plaquing, then often a product like Atherosclerosis, which is a glycocalyx promoter. So basically put up a bigger force field to stop doing damage to the arteries and let the body start trying to repair the damage. And this is while modulating all the other risk factors, the glucose, the insulin, the poor sleep, high stress, dyslipidemia. You're using whatever tools you need to lower the nearly 400 risk factors that can damage the glycocalyx. There's a question about the supplement quercetin for cardiovascular health. Quercetin, very good for certain allergy sufferers, but direct cardiovascular health, I don't use it routinely for that. But that being said, it's usually pretty benign to add on for most regimens. I don't use a lot of it directly. Can microvascular plaque have something to do with a reduction in eye health? So you have nearly 60,000 miles of blood vessels. 99% of your blood vessels are smaller than the diameter of your human hair. So yes, definitely going to have an effect on eye health. Your retina is heavily vascularized. The glycocalyx can get disrupted there from high blood pressure, high blood sugar. So definitely microvascular disease or microvascular plaque could have an effect on eye health. What are you referring to when you say autoimmune dysregulation is one of three threats? This is what Dr. Mark Houston talks about, that there's imminent insults to the arteries, but there's only three responses the arteries can have: oxidation, inflammation, or autoimmune dysregulation, or autoimmune dysfunction. So the immune system turns on and it starts attacking the arteries, and then that leads off to more oxidative stress and inflammation. It's kind of a feed-forward loop. But what do you do clinically with that? This is why often we'll check different markers of autoimmunity. If your thyroid antibodies are elevated and you have evidence of Hashimoto's, autoimmune thyroiditis, you may have other autoimmune conditions, so may check an ANA in those patients. And then this was an add-on question to somebody I spoke to earlier today. They're asking if there's any specific dietary recs. So this was an individual who has confirmed familial hyperlipidemia. They have a gene that affects their LDL receptor, and so their lipoproteins are very elevated from birth. LDL cholesterol is in the 250 range. ApoBs are above 200, so 99th percentile. So talked about some options for treatment for it. I'd done some vascular testing to see how much plaque was building up with these type of lipoproteins. But from a nutrition standpoint, person wasn't suffering any insulin resistance. They had very good metabolic flexibility. And then we had used the Boston Heart Lab panel that looked at the fatty acid balance. So this looks at all the different fats that the people were eating and how well they're absorbing them. There was no evidence that there was issues with the way they were handling saturated fat. They weren't eating any trans fats, and they were getting plenty of omega-3s and monounsaturated fat in their diet. So that being said, there's no things that you have to definitely restrict in this type of case. It's going to require pharmaceutical therapies to affect the lipoproteins. But if you're looking for a good template, Mediterranean template always is going to work well for most people's cardiovascular concerns. But it's always one of those cases where it's like there is no perfect diet for everybody. So this is why I always ask what people's maternal haplotype is. So where did your mitochondria come from? That gives you a good idea where to start thinking about what diet might work for them. Where does the person live in the world? What season is it? You should ideally be eating in a seasonally appropriate diet. So if it's growing in your environment, you should be able to eat it. If it's not growing in your environment, do not eat it. You should eat seasonally, as I already said, but you also should eat in a circadian fashion. So sun up to sundown is the feeding window for everybody for the most part. And then protein. Unless there's a major issue with your kidneys, most people should be shooting for 1 gram of protein for the pound of ideal body weight that they want to be at. So that's the same things I would recommend for this individual. All right. Looking to see if any other comments popped up with some questions. I saw a couple a minute ago. This is something that I've not seen in many years because I don't have an inpatient practice anymore. But somebody's asking about short-term antipsychotic use and cholesterol elevation. I know that this is a possibility with some of them. So, it's going to be one of those cases where like whoever is the prescribing doctor for the antipsychotic has to be the one that warns patients if there's going to be a lipid disruption. And depending if the patient has known vascular disease, what treatments is that person already on, and do those treatments need to be intensified? But it's one of those cases where like there's no free lunches with these things. If it's helping the person's mental health, then maybe that's going to be a long-term use for it. Okay, but they may end up on more lipid-lowering therapies. Somebody's asking, can plaque in an LED be reduced? Yes, and that's not necessarily a flippant answer. I've seen it often in my practice. But first, you got to figure out what's causing the damage to the glycocalyx and the underlying endothelium. If there's a lot of oxidative stress and inflammation, you got to cool those off. If you have dyslipidemia, then you got to find what treatment you're able to tolerate and get your lipoproteins to goal. Ideally, I like to see most people who have vascular disease have an ApoB less than 70. Sometimes you can do that with lifestyle supplements, and we'll always try. But if you're far off of that goal, such as the person who has ApoBs in 200s, it's pretty much always going to take pharmaceutical therapies, and sometimes more than one, to get people the goal. So a question I don't get very often, but somebody is asking, any tips on keeping weight up? They're 113 pounds and generally healthy, and they diet and exercise, or on a healthy diet and exercise. They're worried about being underweight. First, it's always focus on getting high quality protein. So, my friend Dr. Lyon, her saying is people are not over fat, they're under muscled. So it may be a similar situation is that you can be skinny fat and not have enough muscle to maintain your metabolism. So focus on, doing more resistance or strength training in your exercise routine, ideally at least 3 days a week. And then really push for at least a gram per pound of your body weight in protein. And then, look at, is there other reasons that the weight might be low? Do you have leptin resistance? Do you have insulin issues? Do you have thyroid dysfunction? So unknown for sure what may be causing some of the symptoms, but those would be the starting points. So somebody say that they're having somebody on a product called NO2U, since I was on my friend Dr. Lyon's podcast a year or two ago. I was happy with them. Yes, it's just one of the ones where there's a product that's very similar called N101 that the companies tend to focus more on. Dr. Nathan Bryan has formulated both products. They both work. So if you're getting good effects with NO2U, you can stay on them. Somebody's asking, they followed the sun up to sundown eating window, but have had to delay breakfast eating time until a few hours after waking to optimize digestion. Do you have any thoughts on this? I have to know a little bit more, what's really causing issues with digestion, but, and most people, if they're, following kind of that rhythm, you should generally be eating a meal within the first hour after the sun rises in your environment to help maintain leptin sensitivity. The gut should be fairly, scheduled. Most people's bowels should move first thing in the morning. If they're not, then the circadian mechanism to your gut may be broken. So more time outside, getting proper light signals through the eye and on the skin. Many people are not getting light to their abdomen every single day. Start there. So full spectrum sunlight. Potentially you could use red light therapy if you know how to utilize it appropriately. And then, you may need more comprehensive blood work to figure out why things are not on schedule. Somebody's asking, is there any correlation between elevated cholesterol and chronic Lyme disease and IgM from tick-borne illnesses? The lipoproteins are part of the immune system. So if you have any type of acute or chronic infection, you often see dyslipidemia. but it's one of those cases where, like, if the arteries are still becoming dysfunctional from an endothelial standpoint, or you're doing carotid endomedial thickness scans, or you're doing calcium scores or clearly scans, and you're seeing plaque build up, you still may need to treat the dyslipidemia to prevent the lipoproteins from getting retained in the arteries while you're battling with whatever you want to use to lower the infection's burden. So often you do not necessarily, this is kind of a side note, is you don't necessarily want to check a lipid panel when there's an acute infection going on. You expect it to be abnormal. You want to check lipoproteins when people are at a normal baseline, ideally. All right. So I think I got through the live questions as well. So thank you for those that submitted the questions. Every Monday, 6 p.m., we're going to do this. I was talking at the beginning of this that I was just recently in the Low Country, just going for some nice walks in nature, kind of collecting some ideas on how polycardiology is going to grow over the next few months. I had a very large podcast with Drew Purohit drop mid last week. So if you haven't had a chance to listen to that one, I'll leave it in the my stories later today. But if you like this type of content, for 2 hours we talked about the glycocalyx and talked about how to really think about optimizing your vascular health. So Drew Purohit's podcast, if you haven't listened to it, that was a great one. And then there was one recently I also did with Dr. Max from Australia. So if you're more into the quantum biology type of world, that one is excellent to listen to as well. So. Let's see, I think, a couple of people said that they just heard me on Drew's podcast, and that's why they're listening to me tonight. So, all right. So I'll answer this one question, and then I'll pop off here because I got to jump on and do another podcast tonight. So, would an ApoB slight elevation prompt you to take a statin? My cholesterol levels are much better. So, no, not directly. I mean, I always tell people statins are tools. ApoB is the metric you probably do want to follow, but what are your arteries doing? If you have significant thickening of your intima, which is the lining of your artery, if you have soft plaque building up in your arteries, or you have significant hard plaque, you're generally going to see your ApoB lower than the 20th percentile, so an ApoB less than 70. Statins are one of those tools, but not always the one that everybody can tolerate. So there are testing, particularly from Boston Heart Lab, where you can do a cholesterol balance test. Actually, there's a way to do it where you can do it at home. So if you were following me last week, I showed you a picture in my story where I was using a vice grip to hold up a test tube so I could drip blood into it, so I didn't spill the test tube of blood. Well, you do a finger stick, and then you ship it off on ice, and then they run it and give you your cholesterol balance test. So I actually just got the results today. So I'm a pretty good biohacker, so I usually test stuff on myself first. So it took a little less than a week from when I did the collection to when I got the results. And so my results, I was not a hyperproducer of cholesterol, and I wasn't a hyperabsorber of cholesterol. But I'm taking a couple supplements to kind of help modulate that, and I've got my lifestyle pretty tuned in right now. But that test will kind of guide you. If you're a hyperproducer of sterols, statins tend to work better for those individuals. But you'd also want to know your ApoE status. You want to know, potentially, do you have an SLCO1B gene that would potentially increase your risk of muscle symptoms, muscle pains with statins? So I tell people, like, statins are tools. I use them in my practice, but they're not for everybody. Awesome. All right, guys. Well, I appreciate your time and attention. This will ultimately go up on my YouTube channel, so if you don't follow me there, that's where I'm going to really start putting a lot more long-form content. I'll have kind of like a whiteboard. We'll walk through some of these topics in a little bit more detail. And if patients want to kind of like have a poll and, whatever topics wins, maybe that's the topic I'll do just in depth. Because that's how we used to do it about a year or two ago, is that, people would pick a topic and I would do like 30 minutes on just lipids. But got to the point where more and more people just want to ask me anything, so that's why we're doing it this way. But for next week, we'll do a regular AMA, but keep following for breaking news at Apollo Cardiology. So have a great week, and we'll talk to you later.